So I'm 37 years old. The thing that brought me for help here was, well, I had a visit to the ER. Really, when the condition started, I kind of thought like I had a hemorrhoid or something, because like I felt there was a lot of just pain, rectal pain, and that was going on for a few weeks, and then it really started to get more intense to where I was feeling pain in like my testicles and almost even radiating down my leg. So that kind of scared me, which is why I went to the ER. And I was diagnosed with prostatitis from the ER doc, and he gave me some medicine to take, some antibiotics. And really, the more I read about the condition that I was diagnosed with, the more I found that the prescribed treatment really didn't offer a lot of relief from a lot of people that were describing what they've been going through online. And I really wasn't okay with that, because I didn't want to ingest a lot of drugs that could potentially harm my body, if I knew there wasn't a good outcome at the end, most likely. So really, that kind of led me to research what was going on in my body. And I found that online, most people describe that through physical therapy and manual therapy, that they found a lot of relief. And I just thought that really sounded like the best plan of attack for what was going on. When it was first presented to me, the doctor said, well, we didn't see any bacterial in your urine culture, but here's some antibiotics, because a lot of times it doesn't show up, and let's take it for 21 days, and you should be better. I mean, to be honest, it does sound easier just to take a pill and stuff, but generally, to help get rid of the symptoms that I was feeling. But usually I found that a lot of medicines that I've taken in the past, I kind of don't have, kind of sensitive to the medicines, so I always try and look for something alternative or natural, or something that just is healthier for the body. So that's really why it was appealing to me, because I'm not ingesting something that throws off my whole balance of my body, so it's just, it's a little more reassuring to me. At first, I was really anxious, because I didn't know what was causing all this. So a lot of that, like, I was preoccupied with my mind, like just trying to figure it out. So a lot of my thoughts were preoccupied thinking about what's wrong with me and what can I do to heal myself. And so I think first was coming to grips with that, just kind of understanding the overall condition. And really after that, after I've come to a better grasp of what it is, then I feel like I'm doing something to actually make it feel better. The best way to describe how I know what I'm doing is helping me is because in a bad flare-up, I'm able to kind of go back to what I've learned here, and rather than kind of freaking out or whatever, I just go back to what I learned and do some of the stretches or some of the exercises that we've learned here. And immediately I feel it might take it from a level 7 or 8 pain to maybe a 4, which is a lot more tolerable, and I can live with that. But working here has been great. I mean, I really learned how to relax some of that tension, and it just feels a lot better. It's not so tight, and feels like it's something I can control. I think the biggest help has been Debbie's expertise, to know that when something's going on, I can ask, and I can kind of take relief in what I'm hearing, because sometimes it's, you question what's really going on in your body. But I feel like the answers I'm getting are really going to help me. For me, I always go through kind of a checklist of, in the long term, what's the healthiest for me. And I think this is the kind of the path of least resistance, because what you try here and what you explore is not going to hurt you. So, you have nothing to lose really in giving it a shot. So you might as well see how it helps you. Whereas, you could take a bunch of drugs and stuff, and there are side effects, and that's definitely going to happen, whether to what degree or not. But that's for sure. this way of treating the condition really doesn't have any side effects. So I think it's really the first thing you'd want to try because you know you're not damaging yourself in doing it. I'm 100% sure it's not a bacterial infection at this point, and I know that what I'm doing is helping how I'm feeling. 3 to 6 months from now, I know I'll be better than how I am, or the condition I'm in now, which really is a lot better than I was 3 months ago. The overall trend is in the right direction, and not getting caught up in the day-to-day, so to speak, but just knowing to focus on the trend of how you're feeling, and just being confident that the trend's towards getting better.